Hope Channel, changing lives.
Good evening, and you are welcome to the consulting room here on Hope TV. As we do every Monday at 8 p.m., we come to you with all the tips and the knowledge you need to have about your health. And today we are going to talk about our teeth. As usual, we come with all the experts in every field that we talk about concerning our health. And today we have Dr. Ama Amenindakun here with us. If you've seen this wild smile of a picture of a smile in town and they've written under it your favorite dentist, we have your favorite dentist here with us in the studio today. I'm so happy to have you with us here, Doc. I hope you are doing well.
I'm very well, and the pleasure is mine.
Oh, I'm so happy to have you. And I think I didn't tell you previously, but you have a very beautiful smile. When I grow up, I want my smile to be as beautiful as yours. Okay, and I also hope that this week has been good so far, even though it's just a Monday.
It's doing well.
We thank God. All right. So we are going to go for our very first break. When we come back, we are going to get right into the conversation. Today is going to be all about teeth. So if you've not even brushed your teeth, hurry up and go and brush your teeth and come back. When we come back, you get to know why brushing your teeth is important, or if it's not important, Doc is here to tell us. Do well to stay tuned.
Welcome to today's daily health tip, your daily guide to a healthier lifestyle. Today, we're talking about weight loss myth in Ghana. There are so many beliefs about weight loss, which some are not true. But most commonly, there's one that says when you skip meals, you can lose weight easily. In reality, skipping meals can slow down your metabolism and often leads to overeating later in the day, making weight gain more likely. Healthy weight management is not about starving yourself. It's about consistent, balanced habits. Your body needs regular nourishment to function properly and burn energy efficiently. So what really works? Sustainable weight control comes down to three key things. Portion control. Eating the right amount, not just the right type of food. Regular physical activity. Keeping your body moving every day. Reducing excess sugar, especially from drinks. In Ghana, sugary beverages like sodas, sweetened juice, and malt drinks are a major hidden source of calories. Cutting back on these alone can make a significant difference. Other helpful habits include choosing lighter meals, especially at night, instead of heavy late night eating more whole foods like vegetables, fruits, and a balanced home cooked meal. Staying hydrated, as thirsty is sometimes mistaken for hunger. Remember, quick fixes and extreme diets often don't last and can harm your health. Healthy weight loss is gradual, steady, and sustainable. Small, consistent changes over the time lead to real results. Take control of your habits, and your body will follow.
You're welcome back to the consulting room. Today we are going to talk about our teeth. There are a lot of things that we heard growing up concerning our teeth. Some people said when your teeth is paining you and you put akukobini, I hope you know what it is on it, it will heal. I heard that when I was a child, that if someone steps on something, it will cause their tooth to rot. You don't have to visit the dentist because what they do is so painful. You have to wait till you are in pain before you go and see the dentist. we have so many questions. Some people believe that brushing their teeth twice a day is okay. Some people don't even bother brushing their teeth until they're about to leave their house and go out to face people. So today we have Dr. Ama Amenin Darko here, your favorite dentist. She's here to tell us all about her teeth and whether some of these things we've been hearing about, they are true or not. So, Doc, is our teeth important? Is it?
Your teeth are very important. Your teeth affect so much more than your smile. You know, when we think about teeth, the first thing we think about is aesthetics.
Yes.
When you smile, it
brightens
your face.
Yes.
But it's not just for that. It's not just for aesthetics. It's also for the facial support. So for people who've lost their teeth, their faces tend to collapse because where the teeth are sitting kind of support the bone and also give your face a form. So that's one thing. Another thing is that your teeth will also help your speech.
Yes.
So you notice that when we were kids, one of the Christmas carols.
Yes.
All I want for Christmas is my 2 front teeth, and there's a whistle.
Yes.
Whistle. That's because around 6 they don't have their 2 front teeth.
Yes.
And then because of that, they can't mention words like
yes.
Because all of that requires the motion between your tongue and your teeth.
Yeah.
So that's where your teeth affect your speech.
Okay.
Also, your teeth are very important in mastication. And mind you, dentistry is not just about the teeth, it's about the mouth, it's about the facial structure.
Okay.
So everything in this region, apart from your brain and then the throat, all of that is involved in dentistry. So it's not just about smiling. It's even about your interpersonal relationship because you should see how a person lights up once you do a replacement. It's instant. It's like one of the highlights of my job.
I saw a video of a lady. I think she has a denture. Both all her teeth are missing, and the before and after is so different.
Yes.
She looks, I dare say, prettier. With the dentures in than without them, and she's very popular on social media. I've just forgotten her name, but she's an European lady. And when you see how she lights up every time she puts on her dentures, it's so beautiful. It's yes, amazing. It just goes to prove what you're saying.
Yes.
Yes. So,
I remember when I was in dental school. At the time we were understudying all of our. We had our supervisors were understudying, and I had this client come in, and even to show us what was missing for us, she was so covered, she was so ashamed, so shy, and the day we delivered the denture, it was like flipping a switch, and that was when I realized that this is a job I want to do, and it's always been like that for me.
Oh, okay, that's good. So. Oral health is important, whether you are a child or you are an adult. You see, even with pregnancy, there's this concern. Some people think pregnant women shouldn't see dentists, that it would make them lose their tooth. Is this actually, have you experienced anything like this yet?
I have, and it's unfortunate. But then your oral hygiene can even affect your pregnancy in quite a number of ways. There are conditions like periodontitis that can affect your birth outcome. So it can give adverse birth outcomes like low birth weight. It can even give preterm birth. It can give gestational diabetes. It's even been linked with preeclampsia.
Oh, that's interesting.
It's your mouth is linked to almost everything in your body. You cannot ignore your mouth at any point in time, whether you're a child, whether you're middle aged or an old person.
Okay. So a lot of us, we wait till we can actually feel the pain or there's a swelling. Even when there's a bit of a swelling, we don't come until it's so gross and it's so huge. The facial features are distorted before we come to you. Is that what you want us to be doing?
No, you've mentioned a very important point. So some people feel that if I don't feel pain, there's no point going to a dentist. Unfortunately, most dental conditions start quiet. So they would go on for a period, quite a long period, before you would feel anything. So at the point where you started feeling something, it's already late, but it's not late yet. So it's best you visit your dentist, whether you feel something or not. Come, let's check, let's show you and tell you that nothing is wrong. With that, you can't go wrong. But then waiting till you feel a little pain, a little sensitivity, and or a swelling. You know, people feel if you have a swelling, you have to go to the village. I know somebody who knows how to do this.
Yeah.
He's an expert in swellings on the face. Please, please. There are some dental conditions that can kill. And it's because of people who stay and apply herbs, and they come in at the last moment. At the time they come in, they can't breathe. It's almost down. And then I've seen people pass out pass on because of dental conditions, and it's unfortunate because many of these conditions are highly preventable.
Well, that's quite sad because something that is so obvious. It's not as if it's like ovarian cancer or anything internal that you don't see. It's once you look at everybody's face, if they have teeth, you'd obviously see them. So please, why are you waiting till there's pain? Doc says we shouldn't wait, and I'm also advocating, don't wait till there's pain. Go for doc to check your teeth for you. Doc, how many times should I come if I don't have any issue?
Twice a year, because you have so many teeth, and every tooth is an organ in itself.
Oh, okay.
So even if you are taking care of the front well, we will need to check if you are taking care of the back well. If you feel you are taking care of this side well, we'll still need to check if you are taking care of the part around your tongue well. And when you come for a dental checkup, it's not just about your teeth. We check the lining of your mouth, your oral mucosa. We check your tongue. We can pick up if there's a cancer coming up here or there. We can also check other things that are linked to other parts of your body. We've had people come in, we do a hypertension, we check their BP, and we find out, you're hypertensive, or they've been off their antihypertensives for a while.
Yeah.
And then it's time for a procedure. We check and realize the BP is raging.
Yeah, because
I have a client, sorry to cut you. No. I have a client who is always coming back to say thank you. Because when he came, I told him, look, you have to go now, and I'm not going to see you until. So I gave him medication, and as soon as he got to the physician, he was admitted.
Yeah, I was just going to say the same thing. That I think you guys do so well. There are a number of times they've sent patients to me from the dental clinic, and it's because they found out that their BPs are high, and that is the first point they've ever seen that their BPs are high. So the dental issue even became secondary. We have to control the BP first. So please go to the hospital and go and see the dentist. You never know what the dentist will find out for you. All right. So is there something silent that we should be looking out for aside the pain? What else should we be looking out for when we are thinking about our oral health?
So if you are not in pain, but you feel a funny sensation somewhere, it's a sign. It could be the start of sensitivity. So there are different layers in the tooth. Whenever there's sensitivity, it means that there's an exposure to the second layer of the tooth. So come, let's sort it out. If you see blood when you brush,
yes,
that's another sign. It means there's something going on. Your gum may not be as healthy as you think.
Some people are seeing blood every time they brush, and it seems it's normal to them.
No, your when you brush and you see blood, it's not because your toothbrush is hard. It's because your gum is not healthy. Okay. But then again, of course, we don't advocate for hard toothbrushes. But it's not because your toothbrush is hard. It's because your gum is not healthy. When you floss and you see blood, it's because your gum is not healthy. So we need to attend to it. If you realize your mouth is feeling a little drier than it should be, it's a sign you have to come. If you realize your gum is looking bulky, There are people on antihypertensives. Their gum gets bulky. The cyclos, it makes the gums look a little bigger than it should be. Come, let's check it out. It's better you come and we say there's nothing to worry about than wait till it's something to worry about. If you realize you don't feel pain, but there's a part of your mouth that is getting bigger, or a part of your jaw that is getting bigger, it may not necessarily be the normal things like a hole, but then there could be other things that also develop in the bones, ameloblastoma and other things. Once we pick it up, there is a solution. And for every problem, the earlier we pick it up, the better it is for everybody.
That's true. Because it's not just about how quickly you heal. Sometimes the earlier you pick it up, the cheaper.
Indeed.
And people don't believe this, but the earlier you pick it up, the less you have to pay. Indeed. Because if you're going to see the dentist for, let me mention an arbitrary amount, 1 cedi for consultation, and now you have to go and pay 10 cedis for the procedure. Please, that's not how much they charge. Don't quote me anyway. I'm just using that for emphasis. You have to pay. You have to pay 1 cedi for consultation. Now today you are having to pay 10 cedis for the removal or whatever. You see, that 9 cedis could have been used for something. So the earlier the better. The earlier the cheaper, I guess. Indeed. Well, so we've been talking about brushing, the pain. I want you to, a lot of us brush, whether with a toothbrush, with a chewing stick, with a support, but most of us are using the toothbrushes now. And almost every time I've heard dentists speak, they tell us that we are not brushing well. Not all of us though, a lot of us are not brushing well. I'll be so happy if you can show us the good brushing techniques, and if there are other things that you'd want to teach us about how to keep our teeth clean, I'll be so happy for you to do that.
That sounds great. So when you're brushing, first we want to talk about the items we use to brush. There are different artifacts you can use for brushing. First off, when it comes to the toothbrush, we usually advocate for a medium toothbrush, medium bristled toothbrush, and that one is usually written on the pack of the toothbrush you buy. So you look at it, read, and see whether there's medium written on it. If you buy the hard, thinking that you're a smoker, so you're buying a smoker's toothbrush, please, you're going to exacerbate, worsen whatever issue you're having. And you're going to end up with something that is even more problematic for both you and your clinician. So first off, we want to use a medium hardness toothbrush, and then we also will use a floss. Now this floss is something that Ghanaians
we don't usually think about it.
Yes, we do not include it in our brushing at all, but it's very important. I'll be talking about it soon. And then we have a tongue scraper. A tongue scraper, it's a more recent addition. So I'll show you the need for it and how to use it as well. Some people would need an interdental brush. It's a brush for interdental between the teeth. Interdental brush. Some people need that. And then you need fluoridated toothpaste. Okay, so with the fluoridated toothpaste, because fluoride has been proven to form a layer around the tooth to help protect your teeth from cavities or holes or caca. So that's why we recommend fluoridated toothpaste. Okay. Now, apart from that, there's also the hydroxyapatite toothpaste, which is a more recent one.
Okay.
But it must have fluoride. If it doesn't have fluoride, at least the hydroxyapatite one is fine. When you are brushing, you take your toothpaste, and then once you apply it on your toothbrush, we want to make sure we are brush scrubbing all the surfaces of every tooth.
Talk about the toothpaste.
Yes.
Some of us would press about half of the tube to brush our teeth. Like you see the full, even extending past the bristles of the toothbrush. Yes.
It's like washing just a t-shirt with a whole bucket of detergent.
Yeah.
So well, Actually, when you're using the toothpaste, there are actually dosages for toothpaste. So if you have someone like, if you are using the regular toothpaste with a normal amount of fluoride in it, for each age, there's an amount of toothpaste that is required.
Use. Okay.
Especially for our little kids, they eat toothpaste.
Yeah, because it's sweet.
I used to eat toothpaste myself, so I understand them, but we have to prevent it because excess fluoride can also give them a bit of a tummy issue, which we do not want. So if you have a child 1-2 years, we want just a rice grain of toothpaste.
That's very tiny.
Yes.
Oh, but I think a lot of us know the pea-sized.
Yes. So 1 to 2 years, they're just starting rice grain.
Okay.
Then around 6, we can do pea-sized.
Okay.
And then afterwards, that one you can do just about pea-sized, or if you want to use up to here. So far as you are spitting it out, you don't have an issue. But then it's also for commercial. That's why the adverts will
elongate the amount they need. Yeah.
I will finish quickly, but it doesn't mean don't use enough. The toothpaste contains different things to help keep your mouth clean. Some of it contains some antiseptic. It contains some effervescence so that it can froth, so that it can remove foam and remove all the little particles in the corners nicely. And then it also contains fluoride or whatever agent is helping to, amongst other things. So once you get your toothpaste, you apply to the recommended dose to your brush, then you wet it a little. Once you wet it, then you start your brushing. So with the brushing, like I said, you want to get to all surfaces of every tooth. And mind you, your teeth is not just the visible part you see, or like my logo.
That's not you see, I didn't even notice it was there.
The whole teeth is not just the logo where you see your smile from your lips to your lips. It starts all the way at the back, and then it spans the whole distance. And when you open your mouth, we also have surfaces here, all the way. Even around, after you lift your tongue, there are also surfaces there. So every single surface has to be brushed efficiently. Because if I brush all around and I leave this tooth, mind you, it's going to collect debris. Bacteria will form a hole there. And you'll be seeing us soon with a bit of pain, which we do not want. So brushing efficiently is very important. So once you apply your toothpaste, your water, we start your brushing. There are different techniques. Let me start with what not to do. We do not recommend horizontal brushing. This is what everybody does. Please, we don't recommend it. This is what everybody does.
Yeah.
Because when we start brushing, that's what our mommy teaches us.
Yeah.
Do this. It's not recommended because you are not able to brush efficiently and effectively. If you do this, you are leaving all the food in between. You are leaving it stuck there. If you do this, or you do this,
you're just brushing over the ridges. Yeah.
Very good. So you get this surface and this surface, but this important surface in between, you are ignoring all those spaces. And especially if you use a hard toothbrush, you go to town with it, you end up wearing out the outer layer of the tooth, and then little cuts will develop here. That's a different condition. Those little cuts can be very sensitive. Yeah. And they'll come and tell you, doctor, the place is shocking me.
Yeah.
And I drink cold water, I can't bear it. It's because of your brushing technique and the type of brush that you're using. So we recommend, there are different brushing techniques. You can do the circular motion. So with the circular, you incline the toothbrush at 45 degrees to the area between the teeth and then the gum. But don't think about it too much.
Just tilt it a bit.
Just tilt it. Nobody asks you for a protractor. So you just go, you go in a circular motion, you tilt it a little, try and reach all the surfaces. So you go circular motion, okay? Then when you get to the back, incline your toothbrush and get to the very back of the tooth. This is a very important part.
Because there's space there.
Yes.
There's actually space there.
Yes.
If you send your tongue there, there's space there. Yeah.
Yes. And then food collects there. So it's one of the notorious places for cavities to form. Then you open your mouth. The grinding surface of your teeth here is not flat like a table. It has ridges. So food can collect in there.
Wow.
Depending on how your teeth form, some people have deeper ridges than others. Those ones are very likely to trap in food. So make sure you brush those as well. Then the inner part of your teeth, where your teeth, or where your gum is or your palate is, you also want to brush. Still circular motion, or you can do the up and down motion. So you do up and down like that. Okay. That one is also good. You can also do wiggle and out. So you kind of brush the area between the teeth and the gum, and then you flick it out. So wiggle and out.
So if anything is stuck there, it just flicks it. Oh, okay.
Exactly.
So there's a reason behind every technique you've been teaching.
Exactly.
Okay, that's great.
So you realize that then brushing is not necessarily for the teeth, it's for the gum as well. So that's the reason why we have to go through those motions, so that we can clean. There's a little gutter between the teeth and the gum. We want to clean that place effectively, because that's the first place that the plaque begins to form at. So once you clean it and bring it out, it helps protect your teeth and your gum.
Okay.
Once you go through all the surfaces like we've spoken about, then you don't forget your tongue. So your tongue is also not smooth. It's like a towel.
Yeah.
So we want to get rid of any debris there. If you just do circular like this, you redistributed it. But if you are able to scrape it out, you notice that any debris there is coming out. That's why they developed the tongue scraper. So that people who have very hairy, quote unquote, hairy tongues, you can scrape it out nicely. And once you scrape it out, you see, hey, I didn't know all this
something there. Yeah.
For
those who use the tongue scraper, you see there's a
white,
yeah.
Hey, all this was in my mouth.
Yeah.
Good. Now, the only part we've not spoken about is the junction between the teeth.
Yeah.
And this is very critical, because that's where a hole can easily form.
Yeah.
So after you've gotten clean, all the surfaces clean, you now use your floss to go between your teeth. Go as deep as you can against the tooth, then against the next tooth. Same space, but you go against this one, against that one. Sawing motion, bring it out. Then you go for all of the teeth, between
all
every two sets of the teeth. And then the same
for the other.
That is effective brushing. Then you'd have cleaned your mouth very well. You go through the motion again in the evening.
But you see, when you do it, it becomes second nature. I don't even think about it.
Indeed.
I think I started doing this in medical school, right? Of course, I have classmates that are dentists, and we had an interactive session with them, and now I can't even brush my teeth the regular way of going just longitudinal. I use the circular motion, and I always have floss, because I realize that they said we shouldn't be using the toothpick. So yeah, it's easier, and it becomes second nature.
Indeed. The toothpick tends to injure the comb. Okay, so that's why we recommend the floss. Yeah, and then we're good to go.
Okay, so it's I think it was left with the interdental brush.
Oh, yes. Yeah. So the interdental brush, we recommend it for some people. It's just a tiny, it's like a toothpick, but the end of it is not hard like a toothpick. It's a flexible which has some tufts of hair on it. Yeah. So with that, you can also apply a little bit of toothpaste. So if you just brushed, then you also pass it between your teeth. For people who have bridges, if you have a replacement of the tooth, you can clean under the bridge nicely. And then for some people who have certain conditions, but it's also a good way of cleaning in between your teeth without any issue. Okay.
Oh, that's good. I think right before we started talking on the show today, I asked about chewing sticks. Are they good? Or are they bad? Or there's a gray area?
The old people are not wrong. There's a reason behind everything they spoke about. So the chewing stick is also an effective toothbrushing method or tooth cleaning method, provided you are doing it well. Now, there are specific types of wood that are used for the chewing stick. Some of them contain antiseptic, which I mentioned is in the toothpaste, remember? And some of them also contain some are even said to contain fluoride, but we are yet to see the paper on it. So what we recommend is once you are using the chewing stick, you chew it effectively until you get a nice tuft, like a painting brush.
Yeah.
When you get the tuft, you have not finished your toothbrushing. You now have to use that as your brush, and then we can recommend that you put a little bit of toothpaste on it, and then you do your brushing technique. To all the surfaces, not just the visible parts, like I said, all the surfaces of the tooth, like I showed on the model. You can still do the same motion, circular motion, up, down, or wiggle and out. But you have to reach all the surfaces, and that's good brushing technique.
I think for those who have been using the chewing sticks, they can add, now an addition is that you should add a bit of the toothpaste so that it gets the protection. And then not just the front, please. There are several parts of the teeth, the front, the back, the sides. Yes, Doc has said all the surfaces. It's not just the front, because you don't want to be seeing clean teeth, but then behind the scenes stuff are happening. All right, so baby teeth. Some babies come out of the womb with one tooth or so showing, but that's not so common. But we see that around the 6th month after birth, between 6 months and 8 months, a lot of the time you see babies having some eruptions here and there, and then they get a bit of fever, and the mothers will come and see doctor, maybe say, oh yeah. Is it important to keep it well? Because we all know that around 6 years, you will lose your teeth. So why, if it's important, tell us. If it's not important, let's stop worrying the babies.
Baby teeth are very important, the same way your teeth are important to you. So if your child gets a problem with their teeth, it's going to mean sleepless nights for your child. It's going to mean sleepless nights for their caretaker, whether mommy or daddy. It's going to mean discomforts for the child. It's going to mean a lot of poor nutrition for the period. So it's important you take care of your baby's teeth the moment they come in. In fact, before the baby's teeth come in, you're supposed to even help clean the gum and the tongue very effectively. You can use gauze. Some people even use face towel. But you have to make sure you're brushing it well, because like I said, the tongue is not flat clean like a table, so it has indentations. So the milk, breast milk, or whatever food they're taking at the time, by the time I hoping that they're only taking breast milk.
I know, right?
But whatever food they're taking, it tends to also accumulate on the tongue, and that can even create cracks, and then they can bleed, and it's not helpful for the baby, especially if milk from 3 days ago is still on the tongue and you are come to feed the same baby. It's not fair to baby. So it's very important that you clean the tongue very well. You can use gauze and clean it. Our mothers tend to use tomatoes and other things. I'm not too worried because it's natural, but if you use gauze and water, you clean the tongue and massage the gum. That's good enough. The moment the first tooth comes in, you switch to your baby brush. Okay, so the baby brushes are very soft, so you can give it to babies so they chew and use to massage their gum, because they themselves, as the teeth have started coming out, it's irritating them, so they can chew on it and then use it to massage their gum. For babies, it's either you're using, like I said, a grain of rice, or use the baby toothpaste. And you know they're going to swallow it, so very considerable portions, and then use it to brush as much as you can. All
right, so when would you recommend I bring my baby to see you for the first time?
When the first tooth comes in.
So before that, there isn't really the need. So
or unless you have, maybe some people may have ankyloglossia, that's the tongue tie. That one will help relieve that. So if you have any other issue, you can always come. It doesn't spoil anything. We're happy to have you any day.
So in the unfortunate event of me having some issue with my teeth, whether through no fault of mine or some fault of mine, and you advise that we take it out, a lot of us are resistant, or we don't really want to do the tooth extraction, because we've been told that your teeth and then your eyes. If you remove your tooth, you can go blind. Is this true?
Hey, I've never heard. That one is fantastic. First off, the dentist is not there to cause you pain, and the tooth extraction is a last resort. So if we can save it, we will save it. Sometimes clients come in and you tell them, for this one, we can do this for now, monetize. So, to mommy, I've not slept to mommy. For us, we know that every tooth means tooth is gold, and it should be gold to you too. It's a part of your body. So it's not necessarily that even if it's there because it's causing you pain, you should take it out. There are things that we can do to save it for starters. Now, when it's the very last resort and we have to take it out, we have to take it out. Otherwise, if we keep the tooth there, it serves as, we call it a needles of infection. So it's going to, once the infection starts under, it can be a small tooth with a little hole, but the infection will start under, can spread into the jaw. That's what causes the swelling. From there, it can spread into the airway. That's when we have the Ludwig's angina. So remember, I mentioned that some people say their whole jaw was swollen and they have to take it to a specialist in the village. Please, the specialist is your dentist. Come, let's take care of it. Once you can't breathe, you can't swallow, it's an emergency for us as much as it's an emergency for you. So you come for us to take care of it. Then from there, it as soon as you can.
Okay, that's good. Don't wait till there's an issue before you see the doctor. At least twice a year, you have to go see your dentist. There's this whole craze about scaling and polishing. People now are doing it a lot, even though some people are still not doing it. For those of us who are not doing it, what would you say? Is it okay that we are not doing it? And where should we get it done? Who should do it for us? When should we get it done? Yeah.
So scaling and polishing is a way of taking away calculus or plaque that forms around your teeth. Where the calculus or plaque forms is usually between your teeth and gum. So even before you can see it on your teeth, it would have built up downwards towards the gum. So that's how come. In reaction to that, the gum starts bleeding, you feel a little sensitive. The chewing feels like there's something stuck between your teeth, but there's nothing there. All that are signs of gum disease. So it's important that we have the scaling and polishing done twice every year. Because
I'm a culprit. I do it once a year.
Because as I said, the brushing, you can only do it. Some people, you're in a hurry. It's a fast-paced world.
Yeah.
You may not brush as effectively.
Or even twice a day,
twice
as
a day,
recommended.
every day.
Yeah.
You may brush, but you may not brush for the recommended amount of time, which is 2 to 3 minutes. So there are a lot of variables.
Yeah.
So in 6 months, you come for us to use the scaler to clean around your gum. Make sure your gum is healthy, and then we polish the tooth.
Now, if I come and you are doing it so many times, won't my gum finish?
No, it's rather going to protect your gum. So for our repetitive clients, you realize that there's so little to take away, and then the gum is in pristine condition.
Okay.
When you come to your favorite dentist, usually we show it to you on the camera.
Okay.
So book no lie.
Yeah.
I was lying there, and the dentist said, it's there. Me, I've not seen it. We show it to you on the camera. So you say, hey, is this what is there? I didn't know there was something there. You see, and it's no fault of yours. So it has to be done twice every year. For some people, we even recommend every 3 months.
Oh, wow.
Yes. So for such people, when you come, we'll tell you. But it's not something you have to do every day.
Every day. Okay. All right. That's good to know. A lot of us growing up, when you are eating toffee or you buy food, some porridge, and you put a little of sugar inside, they'll tell you your tooth will decay. So is sugar the only culprit for tooth decay?
Oh, sugar is not the only culprit.
Because every time you give a child some toffee, some mothers would go so mad. Why are you giving my child toffee? Do you want my child's teeth to decay? Sugar is not the only culprit. What's other culprits
so once it's a meal and can be broken down to starch, it's a potential culprit. The issue is not necessarily eating the food. There are many variables. Like I said, if you're the type who eats every 30 minutes, you have chewing gum in your mouth, you've chewed it for 2 hours straight, it's still sweet, so you've not stopped. It means you've exposed your tooth to the sugar for all this period. And your body is reacting to it. I don't want to go too technical on it. Once your body is reacting for a long period of time, you are not giving your tooth enough time to adjust, recover, indeed. Then after your chewing gum in 2 hours, you get a toffee. The toffee finishes in 30 minutes. Maybe in another hour, you get a bottle of malt. After the malt, maybe 30 minutes time, you now have your meal, which is rice and stew.
Yeah, which is also carbohydrate, going to be broken down to sugar.
You'll be getting carry soon.
Do I say that's mean or that's scary? Anyway, no, don't worry. No, sometimes you have to be blunt for us to get the point. Yes, so I appreciate that.
So for the kids especially, we recommend that you have a good meal for the kids. If they want to even have their sweets, whatever, they have a period of eating and eat well. Then maybe you give your mouth some time to relax, then you eat again. Not that there's food in your mouth and there's sticky food, then there's chewing plantain chips in the gum, they are chewing the card, even though we are not ruminants.
That's so funny, yeah. Oh, don't worry.
So, all of these things tend to affect your teeth. So we don't want you to have food in your mouth 24/7. Eat, but eat at a specific time. Give your mouth room to recover.
Okay.
And then make sure you brush in the evening so that when you sleep, the germs won't come and have a party with the overnight food.
Especially somebody that hasn't brushed after their last meal.
Exactly. So after you've had your yam, then in the evening as you're sleeping, the germs will now come and have party after party.
Anyway, so you see the way you're smiling nicely, you're talking to me. Do you know people are scared of you?
I know.
And why are people still scared? And what do you do as a dentist to reassure people when they come to you?
Yeah, thank you. So it's because of what has been over the years. So dentistry in the past has been scary. The type of machines we use, the type of instruments we use. Someone said jackhammer and all these hacksaw. I find it funny, but dentistry has improved over the years. Now, we're not just interested in numbing a tooth. We're interested in ensuring that the process of numbing is comfortable for you because the world is improving every day. So when you come, we would want to, even before, if we need to numb your tooth with a little mosquito bite. I'm saying mosquito bite because I don't want to say what it is. Because even mentioning it gives anxiety to people, which is an injection. If you have to numb with an injection, we are very intentional about making sure you are getting the right sites, drying the mucosa, and applying topical gel. I will numb the place before we even apply the injection so that you feel very comfortable. Dentistry is now all about comfort. At your favorite dentist, we tend to sometimes give you a pressure ball. When you come, we ask you what type of music you like. So whatever makes you feel comfortable, then the person, I'm extracting the tooth and the person is singing. I'm like, hey, bros.
You're too comfortable.
You're supposed to be. People think you're supposed to be screaming, but you're singing. You know, it's all part of it, making you comfortable. Even the surgery assistant to be rubbing your shoulder, anything to distract you, anything to keep you comfortable. Sometimes you have relaxing videos that you're watching, or you're in the dentist chair and you are listening to some very nice calming music or calming videos of nature and chirping. And say, hey, am I in a spa or am I in a dentist?
Yeah, that's nice.
These are a lot of improvements that we've done because we want to make the place more comfortable for you.
All right. So so far we've spoken about how important it is to have healthy teeth, what to do, where to go to, when to come see you, and why we shouldn't be afraid. And even with our babies, I think we are learning a lot so far. We are going to go for our very next break. When we come back, we are going to talk about social media. Now everything is on social media, and our teeth is also on social media. So if you want to know what your teeth is doing on social media, don't go too far from the TV. Stay tuned, and when we come back, we'll continue the conversation.
Imagine being told that in 2 hours, you must leave everything behind. Your home, your memories, your future. You don't know where you're going or when you will ever return. For millions of refugees around the world, this is not imagination. It is reality. Every day, families are forced to flee war, violence, persecution, and disaster. Behind every number is a mother, a father, a child. Not statistics, but people just like us. But hope begins when someone chooses to care. Through ADRA Ghana and its partners, refugee families are receiving support to rebuild their lives through farming, skills training, livelihoods, and opportunities for a better tomorrow. Because solidarity is more than sympathy. It is action. Jesus reminds us, I was a stranger and you invited me in. When we welcome refugees, we welcome Christ. This World Refugee Day, stand with those forced to flee. Give hope, restore dignity, transform lives. Your donations today can help a refugee family find safety, opportunity, and future. Together, let us walk as neighbors. ADRA Ghana, to serve humanity so all may live as God intended.
Yeah, welcome back to the consulting room. Today we are talking about our teeth, and even if you missed the greater chunk of the show, it doesn't matter. You can always go back to Hope TV, Facebook, YouTube channels, and go and watch the show again. So we are back to the conversation, Doc. Social media. Now, people, at first, braces used to be something people were running away from because in the past, it's hard to cover your whole head and whatnot. Now it's just a tiny thing in your mouth. It's blinking. It's nice, and people are doing this even at hair salons.
Oh my goodness!
And it's so bad. Like, what's this thing with braces? Is it good? And can I just go to a salon and have it done?
No, please don't go for braces in a hair salon. Please don't go for braces in a hair salon.
What's actually even the use of these braces here?
So braces, they are devices. It's a medical device. A medical device must be given to you by a licensed practitioner. Even amongst dentists, not all dentists are licensed to give you a set of braces.
Oh, okay.
So we need to have a certain level of specialization before you can give someone braces. That's because it takes a lot of calculation to put a set of braces on. So even maybe as a general practitioner, you understand the modus operandi of the whole braces, you wouldn't attempt to do it because you wouldn't want to mess up someone's teeth.
Yeah.
So why would you now submit yourself to the hands of a
fashion? Just for fashion.
Of a
hairstylist and esthetician.
Fancy name.
Yes, I know, right?
Esthetician to apply something on your teeth when you're not sure about how they even sterilized what they're using. In a dental clinic, we have to go through so many protocols to even put our hands in your mouth. Personally, if there's something is not clean, I wouldn't touch it. So I can't see why I would go to someone not wearing gloves, put things in my mouth, and mind you, these devices, they move the teeth. So even in placing it on the tooth, we are directing it in many ways. So your orthodontist will show it, tell it, move it, rotate it by this amount of time, by this amount, or turn it, bring it out, extrude it, or intrude it, or turn it in. And then there are very, very specific,
they are precise
wires that are even being used.
Yeah.
There are specific ligatures. Everything is very well measured. So please, do not go for fashion braces in a hair salon. There's nothing like fashion braces. And mind, if you've gone for it, you are moving your teeth. After you take them off, you won't be happy. You notice that your bite has changed. The way your teeth used to be is not the same. Braces are not for fashion. They are only given to people who need it. Who need it for, maybe there are some people who can't bite properly. Maybe instead of the teeth biting, there's an open bite. That one can, or someone has spaces, then we can close it up. Or somebody has crowding, then we open it up. There, someone's tooth didn't come in, we make a space, we bring it in. There are various things that are being corrected with the braces. Do not go for braces in a hair salon. And teeth whitening, for that matter. Same thing. Same thing.
Because of these DIY teeth whitening kits, are they okay?
We tend to shy. We don't recommend it because there are different things that can happen when you do the self kit at home. Sometimes, if you come to it, sometimes in the in-house whitening, we know exactly what percentage of whitening. So everything is regulated. We can give you instructions on how to take care of it. But if you go for the DIY one, there's something called blanching. That's when the teeth are not white. They are not opaque white. They are pearly white. They have a level of translucency to make it look beautiful and still look a certain way. That's for naturally white teeth. If you go and overdo your home remedy, you could end up with blanching. That's chalky white. Chalky white teeth. It's not aesthetic. It's anything but aesthetic. Also, you could end up with extreme sensitivity because you are creating micropores on the tooth. Extreme sensitivity. And you can even end up with sores on your gum.
Oh, that's sad.
So if it has to go into your mouth, please see someone who's been licensed for your own sake.
Okay. So what of charcoal, use of charcoal? You see, when we were younger, they would use brode juti. I've forgotten the name. Is it brode jo or brode plantain? The tip of the plantain, dip it in a bit of charcoal, and then they use that one. What's of that one too?
So that one tends to act as an abrasive to remove external stains on the tooth. Sometimes in the dental clinic, we also tend to use a little abrasive, something slightly more abrasive than your normal toothpaste. Of course, that's another component of a toothpaste. Abrasives. That's for stain removal. But sometimes we use something more abrasive than the normal toothpaste to remove stains. But these are done in regulated quantity. If you are constantly abrading the surface of your teeth, your enamel is going to reduce. There are different layers of your tooth. There's the outer enamel, then the dentine. If the enamel reduces, it's not going to replenish itself. The only downside is your dentine is more yellowish than your whitish enamel. So if you end up losing a part of your enamel, in the immediate term, you may seem to have whiter teeth, but if you do it for the long term, you end up with yellowish teeth.
So you go back to what you wanted to avoid.
Yes, you come one step forward and you go
several steps back. That's just sad. So, Doc, today has been a very interactive session. We've spoken so much about a lot of things. They said when the conversation is getting interesting, that's when you realize that it's getting dark. So in 2 minutes, can you tell us what you want us to take home today? Tell us what you as a dentist would recommend generally for everybody that has watched today's show. Yes.
In a few minutes, what I'll say is the dentist is your friend. We're here to help. We are not here to cause you pain at any point. So come see us before there's any issue. If you don't have any issue at all, come. We'll be happy with you. If you have an issue, to come. Don't be shy. Don't say we'll judge you. We won't judge you. We are happy you are here. So visit us. Let's check it out for you. Show it to you. Once you are in the clear, hooray for everybody. If there's an issue, we solve it and nip it in the bud before it gets worse.
Okay. Thank you so much. I know our favorite dentist. I've seen some posters around. Are you on social media? Do you have an account, a number if anybody wants to reach out to have you as their favorite dentist? Yes.
So your favorite dentist is a dental clinic. It's located at Christian Village Junction at Achimota. So Christian Village Junction at Achimota. We have a few social media pages. We have it's your favorite dentist on TikTok, on Facebook, and then on Instagram. Okay. So you can follow us, check us out. Sometimes I do educational videos on there as well. Okay. Sometimes we do some befores and afters. So it's also a nice page to follow. If you want to call to book an appointment or for any information, you may call us on 059 33 666 37. Okay. That is 059 33 666 37. All
right. So please, you've had free consultation today. Go and give dentists more and let her check your teeth for you and let her become your favorite dentist. Thank you so much for coming and honoring our invitation.
Thank you so much for having me. It's been fantastic being here. Yes.
I hope we'll be able to have you again because we have so many other topics to talk about concerning the teeth, and we'll reach out to you again.
I'd love it so much.
That's nice. So as we conclude, today we've spoken about our teeth and how they affect our overall health. What to do, where to go to, when to go. What to do, just go see the dentist. When to go, twice a year, even without issues. Go let the dentist tell you you are fine. Just like how we've been advocating. Routine health care and routine dental care is good. Where to go to? You can visit your favorite dentist, yes, but then you can also go to any government facility. Once they have a dentist there, if they are able to help you, they'll be able to help you. Don't become home doctors because you've heard a little about dentistry today. Don't become a home dentist due to that. And do well to join us every week at on Monday at 8 p.m. and we'll be very glad to have you here in the consulting room. Have a nice week.